Hello everyone, I'm Amy Burkett and I'd like to welcome you to Sounding Board, a weekly program produced by the Seroptimus International of Novato. This organization's primary mission is to improve the lives of women and girls locally and around the world. Today, I am honored to welcome back Dr. Shiroko Sokitch, Santa Rosa medical doctor and medical acupuncturist. As seasoned speaker, Dr. Scirocco is highly regarded as California's wellness expert and lead integrative medicine educator. Dr. Scirocco offers both audiences and patients a unique and complete medical perspective, one that blends experience in surgery, 10 years working as an ER physician, and over 25 years of Chinese and holistic Western medicine practice. Since opening HearttoHeart Medical Center in 1993, she has pioneered a new definition of health, one that integrates the importance of emotional wellness as well as the Chinese medicine concept of energy in the body. So thank you so much, Shiroko, for being with us today. Dr. Scirocco is going to be our guest for a series of conversations about living a vibrant life. She'll be addressing the 8 key factors in staying healthy as you age. And those 8 key factors include hormones, brain health, circulation, digestion, appearance, immune system, attitude, and stress management. And in previous programs, Dr. Scirocco talked about hormones as well as healthy aging. And today's topic is going to be immune system. So tell us, Dr. Scirocco, why is the immune system important in vibrant living?
Well, our bodies are constantly interacting with our environment. And when our bodies are interacting with our environment, there are things in our environment that could cause us harm. So our immune system is the protective mechanism that we have to keep us from being harmed by the things in our environment. Every part of our body has some way of protecting itself. You could almost consider it as if our body was constantly in a certain way at war. It's always ready to defend itself. In Chinese medicine, we say, to protect yourself from things that come in from outside your body. Things like bacteria, viruses, parasites, but there are also toxins in our environment. There are also chemicals in our environment and all kinds of things that could come in and harm us. Mm-hmm. Our digestive system is specifically tuned to protect us from foods that would harm us. And the bacteria that live in our digestive system are sitting there waiting to protect us from other things. It's this very intricate, very complicated system that helps us be safe in our environment.
Okay, yes. And so how does it work aside, how does the immune system really work?
Well, like I said, it's based on always watching. So there are all different kinds of white blood cells that are designed specifically to protect us against specific certain things. There are white blood cells that protect us against bacteria, white blood cells that protect us against parasites, the ones that react to allergens. There are, our skin is a protector. If we didn't have skin, or people who have really major problems with their skin are really prone to way more infections and way more trauma to their bodies because our skin holds things out. Our respiratory system is really fascinating because when you breathe in, every single time you breathe in through your nose, there are millions of little tiny hairs that are beating dust and particles out from your respiratory system so that you don't get that you don't inhale chemicals or toxins or dust or anything that doesn't belong in your lungs. And every time you smoke a cigarette, those little hairs get paralyzed and they don't work. So that your immune system, which is one of the first parts of your immune system, is breathing in. Your immune system is paralyzed for about a half an hour every time you smoke a cigarette. And it goes all the way down. When you eat something, your digestive system is watching. Your bloodstream is sitting there after you've digested food, and the food goes into your bloodstream. It's sitting there waiting to see, is there anything here that doesn't belong? And it immediately attacks it. This is if it's working properly.
Okay.
So our bodies are constantly on the alert, constantly waiting to make sure that nothing harmful can enter our bodies.
Great. So for instance, okay, so let's say I have a fever or a sore throat. Is that an indication that the immune system is working, or, how can I nip it in the bud? Is there, ways that I can do that?
Well, when you have a fever, that's your body trying to kill something. That's your immune system responding to whatever is attacking you. Usually it's a bacteria or a virus or an infection of some sort, and your body is trying to prevent it from harming you. So it ups the temperature in order to kill that creature that's trying to kill you.
Okay. And then, so for instance, one would be tempted to take fever medications or sore throat, just to stop it. Is that the correct way, or is there we have to wait it out?
Well, it's a fine balance.
Okay.
When you're thinking about if you have a fever and you're really, really uncomfortable and you can't sleep and you can't rest and you need to rest, when the fever gets too high, then you have to do something about it. But as a general rule, what I suggest to people is if it doesn't get too high during the daytime, then maybe if it gets over 102, you should do something about it, because at too high a temperature, then it begins to harm your tissues.
Right. Okay.
And in children, when their temperature gets too high, they can have seizures and they can have problems with their body. So you don't want your temperature to get too high. At the same time, if you let it be high for a little bit, then that helps your immune system fight what that infection is.
Yeah, that's interesting.
So it's this delicate balance.
Yeah, yes. And usually for me, if I have the fever, I really okay, I'm not working. I want to nip it in the bud instead of waiting for it to be, serious. So give us examples of what happens when our immune system isn't working.
Well, there are two basic problems that the immune system can have. There are many diseases of the immune system, but there are two basic problems. One where it works too much, and it's too vigilant, and then there are times when it doesn't work hard enough. So cancer is an example of where your immune system went to sleep. Because every day we form cancer cells. Every day we're multiplying and dividing cells, and things are changing every minute. And every day we have cells that are mutations. And that's what a cancer cell is. It's a mutation. And usually our immune system recognizes it and goes there and attacks it and stops it from growing.
Okay.
But for some reason, when cancer grows in a person, their immune system went to sleep and stopped paying attention. We don't know why exactly, but that is basically one cause or one symptom of our immune system not working. Autoimmune disease and allergies and asthma, things like that, that's where our immune system is reacting too much to things that are happening. It's as if it's always on the alert, and it's on the alert against things that it shouldn't be reacting to. Like flowers should not make us sneeze. And, grass should not make us be miserable and have a hard time, and yet it does. And so many of us have problems where our immune system is too strong, too active, always overreacting to things. So those are two examples of our immune system going out of balance.
Interesting. Yeah. And then how about attacking, fighting our own body, like the thyroid.
That's autoimmune disease. Yeah.
Oh, okay.
Autoimmune disease is where your immune system reacts against yourself. So there are lots of autoimmune diseases, like rheumatoid arthritis is one type of autoimmune disease. Thyroid, there are certain thyroid conditions where our own body is attacking the thyroid, and then the thyroid either goes too strong or too weak, and it doesn't work.
Right. Okay.
There are lots of autoimmune conditions now. Can't think of all the names of different ones, but
okay.
yeah.
Yes. So how does Chinese medicine handle immune system issues?
In Chinese medicine, your immune system is your outer layer of protection, and it's connected to your lungs. And your lungs, because you breathe in and out all the time, you're always taking in air from outside and circulating it through your body. And so that's the most outer layer of your energy. Everything in Chinese medicine is based on the idea that you're made up of energy. And energy goes from outside to in and from top to bottom and circulates throughout your whole body. So the first thing is to protect yourself from things that come from outside. And in Chinese medicine, it's very important to take good care of your immune system. If you have a flu or you have a cold or you have some sort of viral illness, there are herbs and acupuncture treatments and all kinds of things that you do to make sure that that illness doesn't go any further in your body immediately. It's taken very seriously. And there are specific herbs for specific conditions, and there are acupuncture treatments that will make it leave your body. It's called, the outer part of your body is called the exterior, and so there are acupuncture points that relieve the exterior, that remove whatever that virus is from your body. If you got a flu, for example, one of the things that I think is fairly common when I see people who are either have chronic fatigue or they have a condition where they've been sick for a really long time and they can't figure out quite what's wrong with them. Quite often, if I ask their history, it started like maybe a year or two or months before, whenever they started having the fatigue, it started with some kind of flu, some kind of infection. There's an ancient Chinese textbook called the Shanghan Lun. But it's all about fighting infection, and it's about this thick. It's like 5,000 years old, and it's this whole book about how to keep your immune system taken care of, that because it's that important, how to make sure that it continues to be healthy. If you catch a flu and you don't treat it properly, it can descend into your energy layers and it can make you become chronically ill.
Okay.
So in our modern times, there are conditions like chronic fatigue syndrome, fibromyalgia, all kinds of things where people are chronically ill, and it could have started when they caught a flu maybe a year or two before, and it wasn't treated properly, because what we do is we just wait for it to go away.
Right.
In Western medicine, unless you got a bacteria after the flu and then you take an antibiotic, but an antibiotic won't make the flu go away. So you just have to sit it out. But with Chinese herbs, you can take herbs that will help it go away, and it'll clear out of your energy system so that it doesn't then cause chronic problems.
Okay.
So Chinese medicine is completely different, because I don't want to say it's the most important, because every system is very important, and it's really important to take care of your whole body, but taking care of your immune system will protect you from so many different things.
Sure.
And it's kind of, if you think about it, our immune system is our energy's way of interacting with our environment. So it's a relationship. And you want to make sure that that relationship with our environment is always healthy.
Interesting. Okay. So
That's how I think about it.
Yeah. So you mentioned about herbs and treating it at the start of it before it becomes worse and it becomes a chronic illness. So what happens if it goes to that point already that the symptoms were not treated correctly and stuff like that. So can we still use herbs in that case, or?
Well, there are herbs for every stage, every level.
Okay,
One
okay.
of the things that my friends laugh at me for is when I say, I have herbs for that. There are herbs for everything. And so it's better to catch it at the very beginning if you can stop it. And most of my patients who've been my patients for years know what to do now. You know, they know what to do as soon as they start getting ill because they have been with me so long, and they'll take the right herbs for the right thing, or they'll call me and say, which herb should I be taking now in order to nip this in the bud. But if you let it go on and you come, let's say you've been coughing for 3 weeks, there are herbs for that. And
Okay.
and acupuncture really, really helps with that. The thing is that in Western medicine, it is, especially if you have a virus, if you have a bacterial infection, we have antibiotics. If you have a parasite, we have medications for that. And I don't hesitate to prescribe medications when I think people need them. But for a virus, there aren't that many solutions. You know, we have the flu shot, which will protect you against a few strains of the virus. But if you got a virus that wasn't one of the things protected by the flu shot, then you would be sick, and there isn't much we can do. So we have all these medications that only block the symptoms. Like stop the
Yes.
stuffy nose, stop the sore throat, suck on these lozenges, take that fever medication. And to me, actually, if you do all that and you do that for I think that's one of the reasons that instead of 3 days or 4 days, you're sick for 3 weeks. Because if you take all those drugs, you're blocking your, like we were talking about earlier, your immune system is designed to fight those infections, and some of our symptoms are our immune system doing its job. And here we are blocking it,
Right.
preventing it from doing its job, and so then it has to fight harder, or it takes longer. So, not that people shouldn't be comfortable, because I totally don't believe in people being in pain or uncomfortable, but a little bit of discomfort is worth it, because then you can get healthy faster.
Yeah, that's interesting.
Yeah.
Exactly. So what can a person do then to boost the immune system or to take proper care of the immune system?
Preventive medicine is
Yes.
very important.
Yes. I'm
And
for
again,
preventive.
yes, for good health. Well, it depends. You know, the very basics are taking good care of your diet, making sure that you, like sugar. Sugar actually is similar to a cigarette. If you smoke a cigarette, you block your respiratory system from being able to protect itself. When you eat sugar, you block your immune system from being able to protect itself for some length of time. So eating a lot of sugar blocks your immune system from functioning well. So good foods, lots of vegetables, fresh fruits, you know, what everybody talks about. There are exercising is
Okay.
really valuable. People who exercise seem to not get sick as much. And then probably the most important thing is stress. Is to deal with stress, and people get sick around the holidays when there's so much stress with families, or they get sick right when school starts because there's lots of germs walking around, but there are also lots of stresses, you know, starting class and doing all those things. So taking care of your immune system means figuring out, okay, if I'm really, really stressed, what can I do to handle that? Can I take an extra nap? Or can I take a night where I don't do anything, even if I have a lot to do, or I just relax, you know, and kind of plan into your time that you manage your stress. And exercise, of course, helps manage stress, and it keeps your body fit. Then beyond that, there are 2 major supplements that help so many things. One is omega fatty acids, either making sure that you have them in your diet or making sure that you take them as a supplement, because they help your brain and your hormones and your immune system. And vitamin D, which even conventional doctors now are using a lot, because it's been discovered that if you have a good enough level of vitamin D, your immune system functions a lot better. In fact, they even say that you can take it to stop a cold when you start to have one. So those are some things, but there's a really long list depending on where you are. To me, each person is an individual and each person has a different set of problems. So somebody who has chronic sinus problems will need a different prescription than a person who has asthma, than a person who's just everyday healthy, living their life and just trying to prevent themselves from getting sick.
Right. Okay. So for instance, as far as I think for stress too, there are adaptogenic herbs that help the body fight the stress. How about allergies, for instance? Like, okay, one has the hay fever and stuff like that. What specific, home remedies could you suggest? Or
Well, there's a lot.
Okay.
Home remedies.
or
Yeah.
or
For me,
herbs
acupuncture is remarkably effective in actually curing allergies. I've got hundreds of people who've come to me for allergies, and there's a series of treatments that I do to help them prevent them from having them the following year. So you can either come before allergy season starts and have a few acupuncture treatments, which will prevent you from having the symptoms during the season. But there are people who have allergies all year long, and then that becomes a little bit more difficult. Or people who are allergic to everything.
Okay.
That is a lot more difficult. So that would require a whole series of home and office sorts of treatments to get them into balance so that their system can begin to fight the right things instead of everything.
Okay.
But one thing that's really effective for allergies that you could do at home is the nasal washes.
Okay.
You can buy the little neti pots and put salt and water and rinse your nose out. Have you seen neti pots? They look like a teapot, and they have a little open thing, and you pour room temperature water or body temperature water in it, and a teaspoon of salt.
Okay.
And then you rinse out your nose, and it washes out the pollens.
Okay.
Another simple sort of home remedy is to buy baby shampoo. Because it doesn't make your eyes water.
Yes.
Or doesn't hurt your eyes, supposedly. And you put 1 drop of baby shampoo in like this much water, and then you make sure it's all mixed up in there, and then you rinse your eyes, and then it'll take the pollen out of your eyes if you have really itchy eyes.
Okay, yeah, because sometimes that's it. It's like, red puffy eyes when, there's allergies. What do you think of things like the flu shot and immunization? I know you've alluded to that a few minutes ago, but...
Overall, I'm not against immunization. Immunization is a way to protect your body against certain things. It saved the world from smallpox. Years ago when they discovered the vaccine for smallpox, people were dying of smallpox, and it stopped that. The problem for me with the flu shot is that there are several things. One is that it only protects you against 3 possible strains of a virus that could be coming. And 2 is that if you're already weak and you take the flu shot, it might actually make you worse. It might make you sick. Overall, I'm not against it. It's just that for me, it would be better if you were protected from everything by having a strong immune system. So if your body's healthy and your immune system is able to do its job, then any virus that comes, you'll be safe and you'll be able to take care of yourself. Or if you do get sick, you'll only be sick for 2 or 3 days or 1 or 2 days. I got a cold and I was sick for 1 day with a cold. And when I caught the flu, I was sick for 5 days, instead of 3 weeks. So if you have a healthy immune system, it's not that you'll never get sick, but when you do get sick, you recover quickly and you are able to fight off most things. Does that make sense? So, and overall, all immunizations, I'm strongly in favor of some immunizations, but again, there are, in children under 5, 26 different immunizations that they have to have. And that means that a lot of them happen before they're even 6 months old. And so their immune system isn't even developed, and they're getting all these invasions of potential infections, and their immune system has to deal with that. And I just think there might be a more effective way to do that.
Interesting. Yes. Okay. And some of the effective ways, for instance, as far as like when the
spreading
babies,
them out more and not having all of those vaccinations. There are some vaccinations that are maybe not so effective. like the one for ear infections, it doesn't last very long, and it's not that effective, and ear infections aren't that harmful, you know. So maybe it would be better to have a polio vaccination and a diphtheria vaccination than the ear infection vaccination. You know, like if you're going to prioritize.
Right. Yes.
But again, everybody's so individual and everybody's so different. It has to be sort of individual decisions based on the parents and what's going on in that community. You know, there might be a community like pertussis, which is the whooping cough. A lot of parents in this area and in Sonoma County choose not to have their children get the whooping cough vaccination. And so now whooping cough is a big problem. And that is a very harmful infection, you know, because people cough for months on end, and it spreads like wildfire. So it'd be better to have that vaccination.
Okay.
But it might be better not to have another one, you know, like hepatitis B, which they're much less likely to catch than whooping cough, you know.
Right, right. And I remember, I think in my son's school that was a requirement.
To have the whooping cough.
Yeah, the vaccination or something. So schools are also recognizing the importance of certain vaccinations, that it's a mandatory one.
Certain ones. And that's, I don't think if a little is good, more is better. I don't think having 26 or 30 vaccinations is good for your immune system, you know. So I think it'd be good to figure out which ones are absolutely necessary and which ones aren't absolutely necessary, and then prioritize, you know, to make sure that child has a healthy immune system growing up.
Right, right. Okay. So I know at the start you mentioned about our bodies at war. It's always at war. And then so what can we do about it, you know, just to wrap things up?
Well, it's a long conversation.
I know.
It's one of those philosophical things, but when you're thinking about it, it's like if you start to, again, pay attention to your own body and learn to listen to your own body and learn to know what feels good for it. And each person's an individual. So listening to your body is so vital, and learn what it likes. There are foods that aren't good for you. There are exercises that might not be good. If you exercise regularly and you eat the foods that feel good to your body, then you begin to dance with your environment and with your life rather than be at war with it. And that is a more vibrant way to be healthy.
Great, great. So if people want to find you, how will they find you?
My website is www.hthmc.com.
Great.
I'm in Santa Rosa and Novato.
Awesome, awesome. Well, thank you so much for this very enlightening discussion on Immune System 101. And also thank you to our viewers for watching this program. Thank you for the Seroptimus volunteers who always, you know, through their commitment is making Sounding Board, you know, possible. And of course, last but not least, thank you to Rick and Leon of the Novato Public Access Television for always assisting us. And so take care and see you again at our next conversation on how to live a vibrant life. Bye for now.